Dr. Michael Garber is a postdoctoral fellow at Colorado State University, working with Dr. David Rojas Rueda, studying the impact of green space on human health. He has conducted research looking at how bike trails and bike use impact human health as well in Atlanta. And he is really interested in how the built, social, and natural environments affect human health. And I think that's so important to think about that component as we think about incorporating pollinator habitat. He received his PhD from the Department of Epidemiology at Emory University Rollins School of Public Health in 2020. In 2021, he received the Rothman Prize, awarded by the editors of the journal Epidemiology for the best article published in the journal that year. So I'd like to welcome Dr. Michael Garber. Thank you. Oh, and one more note. If you have questions, please raise your hand during the session, and our volunteers will gather the cards during the session so we can kind of move quickly into the question session. Thank you.
Thank you so much, Amy. Oh, green. Cool. Thank you so much, Amy, and thanks for the invitation to be here. Yeah, so I'm gonna, I think, come with a slightly different perspective. I'm not a native plants biologist. I'm not an ecologist. I'm a public health researcher, and so I use information, parts of the information that you all know much more deeply than I do, and try to apply it to estimate the effects of pollinator habitat, of green space on human health. Sorry. This, like a pop-up, this McAfee thing. Oh, there you go. Yeah, okay. Sorry, just having some pop-ups in the way. So yeah, just to tell you a little bit about myself, as Amy mentioned, I'm an epidemiologist by training from Emory University in Atlanta, and my focus as a PhD student was really exploring the impact of the built environment on health in general, but specifically on physical activity through bicycling and also bicycling safety. And so generally I'm interested in the effects of the environment on health, including, as Amy mentioned, both the built environment and the natural environment, more recently with my work with David Rojas at Colorado State. And so I'm really excited to kind of learn from you all more about specifics of pollinator habitat and native plants and their importance in ecosystem health generally and in human health. And before I begin, I want to mention that fortunately, I'm not the only person on this project. David Rojas is my mentor at Colorado State. I've also worked with a graduate student, Daniel Dean at Colorado State. And on our team, we have experts in horticulture and landscape architecture, including Jen Boussalat and Michael Garber, who I believe is actually affiliated with the Denver Botanic Gardens, where we are. And then we have some input from folks at UC San Diego as well. So the outline of my talk is, first I'll go over some of the existing research on the impact of green space on health. And then I'll describe our study, which estimated the impacts of native plants policy scenarios on premature mortality in Denver. So there's a kind of an emerging field of, in epidemiology, it began as clinical medicine, studying things like drugs on health, and it's definitely over the last decade has broadened to include more of the environment and health. And so there's certainly an emerging field of studying specifically green space exposure on health outcomes. And here's kind of a table summarizing some of the evidence to date. So folks have looked at things like cognition, mood, and attention as an outcome, as being exposed to, if you're exposed to green space, you're walking through nature, forest bathing, as I think someone mentioned. Those can all have, there's evidence of a positive effect on those outcomes. Mental health and depression has also been examined through some cross-sectional studies. So when I say cross-sectional studies, meaning just surveying people at one point in time, not necessarily following them over time. Much of this evidence is based on that type of research, which is inexpensive, and that's why it tends to be done more. It's harder to follow people over a long period of time. There's evidence of reduced cardiovascular disease, reduced blood pressure as a result of exposure to green space. Physical activity is maybe, at least to me when I started working in this field, is perhaps the most obvious or the most thing that came to mind for me. So if say you live near a park, you may be more likely to be physically active because you have access to that park, you can go for a walk. And then through a lot of these mechanisms, there have been some long-term studies, so following people for 20 to 30 years, and they have found, so my mentor at Colorado State did a meta-analysis, which is like an analysis of multiple studies to try to come up with a summary effect estimate. And they have, and that meta-analysis found, restricting only to cohort studies, so somewhat higher quality evidence, that there was a slightly reduced risk of mortality among people who, by their definition, were exposed to more green space, and specifically higher levels of NDVI, which is the kind of the satellite imagery-based method for measuring green space, which I'll talk about in a bit. So how might being near green space affect mortality? And as an epidemiologist, I'm taught to be very skeptical. Like, do I really believe that? Like, if you spend more time in nature, is that really gonna affect your mortality risk? But I do think there are some plausible mechanisms, particularly in the older age populations. It may, there's evidence that it can delay mortality, and it could be through various mechanisms, including green space can cool temperatures in the nearby environment, which can mitigate microheat islands, which is very important as we have a warmer climate. And what microheat islands, for those who aren't familiar with the term, just means locations within cities that, because of their high levels of impervious surface, lots of buildings, lots of roads, they tend to trap heat and they don't release it as quickly at night. And so green space is a way to mitigate that effect, because green space has a cooling effect, and then through that pathway could reduce heat-related mortality. It can also reduce noise, which has an impact on stress, and reduce air pollution. And those pathways are all, in theory, are beneficial whether you live really close to the green space or not, or whether you yourself are immersing yourself in nature. These are kind of less direct pathways that still benefit everyone. And then some other pathways which may be more related to actually visiting green space or going to a park, taking a hike. So physical activity, as I mentioned, is one. And then social connectedness and cohesion, kind of having a sense of place, maybe having a gathering or a neighborhood event at a park. That could be another way that green space can impact health. And then reduce stress and mental health has been studied a lot in this literature. And some of these studies have actually looked at like post-operative patients, and they've given them images of nature and a concrete wall. And they've found that just the sight of nature actually improves their stress and kind of accelerates their time to leave the hospital. So that's more of just an aesthetic benefit, whether or not the nature exists in truth at all. So there may be some sort of just a visual pathway that impacts stress. And then I'm certainly missing lots of possible opportunity. Like, I'm sure you guys may have other ideas on how native plants and pollinators affect health. So this literature, to me, kind of coming at it from a somewhat, I'm relatively new to the literature. To me, it seems somewhat underdeveloped. Like as I mentioned, lots of the research is cross-sectional. So more longitudinal studies are needed to really assess the impact on health over time. It's not really clear what the dose of green space should be for improved health. Meaning like how long you have to spend, and how often you have to go visit nature. And I would assume this would depend on the specific health outcome. And as you might imagine, measurement of exposure among humans to green space is difficult. Increasingly now, as everyone carries a GPS tracker in their pocket, and so people are using GPS data and kind of smartphone data more and more to monitor humans as they travel through the environment. So that's kind of that paradigm called activity space in the kind of public health literature. It's being used more, but still much of the research to date, that a lot of the evidence is based on is still just based on place of residence, which doesn't necessarily consider where you go to work or where you spend a lot of time, although it may. And then finally, almost all this research is observational and not experimental. So confounding is a big issue that is, it's really hard to control. So for example, it may just be that people who live near green space also tend to be healthy for other reasons. Maybe they have better access to food, better access to resources, and therefore they live longer, but it might have nothing to do with their green space exposure. Researchers do try to control for that through, there's lots of methods for trying to control for that, but it's still hard. So I'm going to go through one common method for measuring green space, and that's using satellite imagery, specifically the normalized difference vegetation index. And so many of you may be familiar with this, but less than 1 typically means water or a very reflective surface. Less than, say, like 0.2 is impervious surface or rock. And then as you go closer to 1, the kind of intensity of the greenness heightens. And this is great. This measure is widely used primarily because it's a Lancet, or it's a US government funded data set, so it's free to everyone worldwide. And it covers the entire globe. It's available at a fairly high spatial resolution, meaning it can measure a small area. At least to me, it's a small area because I'm used to, epidemiologists often think in terms of like census tracts and counties and states. And so Landsat data is available at like 30 meters squared, which is pretty small, but sometimes it's actually not small enough, especially if you're thinking about pollinators and plants. It may actually be too coarse. But a disadvantage of the NDVI is that it doesn't measure the type. So to my knowledge, NDVI can't necessarily discriminate between a native plant that's great for a pollinator versus another type of plant. And also clouds can block the view. So just to give you some practical kind of insight into what this looks like. So this is NDVI values for Denver on July 4th, 2021 as measured by Landsat 8. So you can see that it does, it picks up quite a bit. Like you can discern the I-25 corridor. Colfax Avenue looks like it's visible. And then the Denver Botanic Gardens, where we are right now, is in yellow. And as we zoom in, you can kind of see what the pixels look like. So that's, the kind of dark spot is downtown Denver. And this is the area around the Denver Botanic Gardens. So, if you were to try to zoom into a garden or a specific plot at the gardens, it may not do a great job of that, of measuring that exposure. So, as I think this is preaching to the choir here. I don't need to tell you all this, but expanding green space with exotic plants such as turfgrass is not ideal because it can stress water and soil, can harm biodiversity, including pollinators, and it often requires support from chemicals like pesticides. And all of these have negative consequences for human health. Native plants have been proposed, or native or adapted, or at least diverse plants have been proposed as an alternative that may be more climate change resilient, drought tolerant, and less expensive to maintain. All of these characteristics being particularly important in the western United States, which is going through severe drought and record-breaking temperatures every year. And then I also want to highlight the focus on health equity because the city of Denver has done a great job, in my opinion, of highlighting equity in their planning documents, as has the Colorado legislation recently. And and this is a vital consideration, of course, given the inequitable distribution and impact of environmental exposures in the United States. So there's been, I described some of the research to date. To my knowledge, there hasn't been any long-term studies that have studied native plants specifically on human health. Much of the research is in free-living populations, so it will include, people who are exposed to some native plants. It doesn't, but there haven't been necessarily focused studies on native plants specifically. So that's what I want to focus on right now is our study estimating the impacts of native plants policy scenarios on mortality in Denver. So our goal was to estimate the number of annual premature deaths that would be prevented by the implementation of policy scenarios adding native or highly diverse vegetation in Denver, Colorado. And to inform the impact on health equity, we've also stratified or categorized our results by indicators of socioeconomic disadvantage. So this type of study it's called a quantitative health impact assessment, and basically we're using existing evidence that's already in the literature. So we're not necessarily developing new kind of causal effect estimates on native plants and health, but rather we're applying previous research and using some other inputs as well to basically get a ballpark estimate. It's more or less a fancy back of the napkin calculation to estimate how much hypothetical mortality could be reduced were we to implement these policy scenarios. And the study area is the city and county of Denver, excluding some areas of the Northeast, and restricting to adults 30 and older, simply because most of the cohort studies on this topic have been in older, at least adults 30 years and older. So these are the roughly 5 steps that we took. So first, our first challenge was to define an NDVI value that corresponds to native plants, because we did use NDVI despite its disadvantages. We then interviewed 8 stakeholders, I think some of whom are in this room, and we're grateful for their insight, who kind of proposed, basically just picked their brain. We wanted to learn what their priorities were related to native plants policy, to see how we might use their feedback to develop some rough policy scenarios. So we then we kind of proposed hypothetically 4 native plants policy scenarios informed by these interviews. The first was to green 30% of the area of all block groups in Denver. A block group, for those of you who don't work with census data, is like a subdivision of a census tract. So it's a smaller division of a census tract. So a pretty small area. Greened those with 30% native plants. And in this intervention idea, we're not necessarily picking where exactly it would go, but we're just trying to raise 30% of the block group's area to the level of native plants. Second idea is to green riparian areas, so waterways, streams, and lakes. This was suggested by a stakeholder we interviewed because riparian areas are very important for habitat. Third, to green stormwater retention ponds with native plants. So these are like large stormwater retention ponds that are already being implemented in the city of Denver. And it was an idea by the Office of Green Infrastructure to just to estimate their impact on mortality. And then finally, parking lots were kind of brought up as an opportunity for greening because especially because the difference between impervious surface and native plants should be a fairly large impact on health, because you're going from essentially a built desert to some vegetation. And so our exposure assessment is the 4th step, and then that's do you have a question? No. Okay. Well. Okay. So to assess exposure to these different scenarios, we first measured kind of status quo or baseline NDVI in residential areas surrounding these interventions. And we then compared that NDVI level to the definition of native plants that we found. And then we did some math and and came up with an estimated number of deaths averted. Just want to keep an eye on time here. Okay, I know I'm between you and lunch, so I'll try to speed through this a bit. So to define, so this is a major source of uncertainty in this analysis is what NDVI actually corresponds to native plants, and it turns out it's a pretty big range, at least from what we observed. So the native vegetation in the Denver area is grasses, herbaceous plants, and shrubs. And so using the expert knowledge of our colleagues, we selected 3 places in the Denver area that they felt would kind of represent the spectrum of native plants. And so we chose Green Mountain, west of here in Lakewood, not technically city of Denver, but still kind of representative of the region. And then 2 plots in the Denver Botanic Gardens. So one 100% native plot, and then a green roof as well. That doesn't, it's not 100% native, but has a lot of diverse vegetation. And we then measured the NDVI of those places, and there was a pretty broad range. So as low as 0.34 for the Denver Botanic Gardens green roof, and as high as 0.54 for the Denver Botanic Gardens short grass native plot. So this made it somewhat challenging to use these definitions in our analysis because it was such a wide range of values. So we ended up just using all 3, and we ran the numbers and we presented a range. And just as I described, we interviewed 8 stakeholders, and we asked them questions like, if you could wave a magic wand to change the natural landscape of Denver so that native plants or pollinators proliferated, thrived, what would you do? And so, and a few other questions along these lines. And so I already, I think, broadly described these, but just to reiterate, so we have our first scenario, which is kind of block group level. We're not picking exactly where the native plants would go. We're just kind of, in general, we're saying, okay, what if you raised 30% of the land of each block group to native plants? And this was inspired by kind of the call to action to protect 30% of lands and oceans by 2030. The second policy, again, adding a 200-foot buffer to riparian areas. The third proposed policy is implementing these large stormwater retention projects, of which about 70% would be native or adapted plants. And then finally, replacing 30% chosen arbitrarily of parking lot surface with native plants. And just for reference, about 9% of Denver's area is a parking lot. So it's an impervious surface, which contributes to the microheat island effect, and in my opinion, has other negative consequences. So the meta-analysis that my mentor David led found that those individuals who lived within a 500-meter buffer of their home had about a 4% reduction in their annual mortality risk than those who did not. So to kind of be consistent with that previous literature, for the location-based interventions, so scenarios 2 through 4, we drew in a GIS software, we drew 500-meter buffers around all the intervention areas, and then estimated the people living within those areas, and we measured the NDVI in those areas as well. And another kind of, so to complicate things a bit, it turned out that a lot of these block groups already had NDVI values that were higher than some of the native plants' NDVIs. So, and we didn't want to necessarily reduce NDVI because the evidence shows it's somewhat simplistically like a linear relation with as you increase in NDVI, you have a positive impact on health. So we ran the numbers 3 different ways, and each way we only propose intervening upon those block groups that were below the NDVI of native plants. So you can see that had we relied exclusively on the NDVI of the green roof, we actually wouldn't have intervened on many. A lot of the, so just a lot of the block groups would have been removed from the analysis because they actually already had NDVIs on average higher than the green roof. And then this is the kind of what the scenario looks like for the riparian areas. So just again, we measured the NDVI levels within a buffer of the riparian areas, and only proposed actually changing though the 200-foot buffer because that was what was suggested by our stakeholder. And here's a visual of the stormwater retention ponds, and here's a visual of the parking lot. So this is the just a map of Denver's parking lots, and then if you actually extrapolate that and say how many people live within 500 meters of a parking lot, it turns out it's basically everybody. So so this scenario turned out to be basically the same as our first scenario, which is illuminating in and of itself, I think. So our final step is we calculated the premature mortality averted. We used census data to estimate populations. We restricted to 30 years old and older. For the mortality rate, we couldn't find any mortality data that varied at the census block group level, which is the neighborhood level. So we used statewide data, but we did use age stratified, so estimated a mortality rate for every age group. So that was another input. We used the difference in NDVI between kind of the status quo, the current scenario versus this native plants alternative. And then finally, we used the value from the literature, so the estimated effect of exposure to green space on mortality, premature mortality. And this is what we found. Sorry for the huge table, but I'm just going to focus on the bold. If we go all the way to the right, kind of the main result is that per 100,000 people, we estimated that if we raise all block groups to the level of native plant, the NDVI of native plants, we would prevent annually about 11 deaths, like I said, per 100,000. So, and that ranges, and this range considers our uncertainty of NDVI at all. So it could be as high as 24, it could be as low as 9. A lot of uncertainty, but generally in that ballpark is what we found. So, maybe between 10 and 20 per 100,000 per year. Other things to note. So the difference in NDVI actually isn't, part of the reason that number might not be that striking is because the difference in NDVI for many of these was not very high, in particular for the location-based interventions, because kind of based on we only propose intervening on, say, the riparian areas, but we assume that people living within 500 meters were exposed to those. And so this kind of the status quo NDVI ended up outweighing the change. The retention basins, just because it wasn't that much land area, ended up, based on our methods, wasn't a huge impact, about 1 death per 100,000. And the parking surfaces was less than the block group level, even though it was a lot of people affected. It ended up being a smaller difference in NDVI because we weren't proposing intervening upon the whole block group, but just the parking lots themselves. And then we stratified the results based on Denver's equity index, so lower being more disadvantaged. And somewhat surprisingly to us, we didn't see much of a difference in terms of more disadvantaged populations perhaps being benefited more by these interventions. And that could be because, in a lot of cities, NDVI is associated with wealth generally. Like wealthier people tend to have better access to green space, and for whatever reason, in Denver, that's still, based on the numbers we found, is still somewhat true, but not as striking as other cities. Here's the scatter plot of that. So NDVI on the y-axis and the equity index on the x-axis. So not kind of a somewhat, the relationship is as you would expect a bit, but it's pretty, it's not super kind of a tight association. So our work has, I really view this as like a first step. There's lots of limitations, but one limitation is the NDVI-based definition of native plants. I think this is where there could be great opportunity for folks in this room to get involved in public health research, is because I don't have a great way to kind of measure native plants and pollinators exposure on health. So would love to chat about that. Other health, some might be surprised at why are we focusing on mortality? There might be other short-term impact, other shorter-term health outcomes that could be more useful. But just the evidence to date, for whatever reason, is better on mortality. So that's what we used. But things like cardiovascular disease incidence, stroke, perhaps stress, depression, that could also be used. Also could be assessed in future research. As I mentioned, we didn't have within-city estimates of the mortality in Denver, so that was another limitation. We didn't account for population mobility, so we used a residence-based definition of exposure, but that doesn't necessarily mean that that's truly what people would have been exposed to, especially if they, on a regular basis travel long distances. And then finally, as in observational research, there's always the chance that even the meta-analysis is confounded. Okay, so just to summarize what we did, so we estimated premature mortality preventable due to implementation of native plants policy scenarios informed by stakeholders. We did this research because cities often use non-native plants, such as turf grass, to expand green space, which does have benefits. It can reduce microheat islands. It can be a great place to go, play baseball. But it has negative consequences for biodiversity, as this room certainly knows better than I do. What we found in the most ambitious scenario, an estimated 33 total annual premature deaths would be prevented, and that translates to 11 per 100,000, as I spoke about. Several limitations, which I just described in the previous slide. And I think a big area for future research would be to improve the measurement of human exposure to native plants, and you could even broaden that to, diverse and adapted plants for epidemiologic research. Here's a list of helpful reading. I want to thank the local experts we interviewed to help us guide this research, and my co-authors and collaborators. Thanks.
Thanks, Michael. I have some questions from the audience.
Okay.
So the first question is, can you talk about the trade-offs between large urban green spaces and urban walkability? This person asks if spaces that are too large impede walkability and force driving, which has clear negative health effects.
That's an interesting question. I haven't really thought about it in those terms. But there's in the built environment kind of walkability literature, I know that there's work on connectedness and trying to avoid cul-de-sacs and improve, allow people to walk in more straight lines, essentially. So I could see how a giant urban space could impede the ability to walk in a more direct path to get to where you want to go. In my personal experience, especially if the park is fairly open to the public and has lots of entrances, I personally enjoy walking through a park or an open space to get where I'm going, but that might depend a little bit about the number of entrances to the park, how far you have to walk, go out of your way to walk or bike. Yeah.
So another question is, do your studies account for the effects of having unhomed people using green spaces on the premature mortality of potential conventional users?
Mm-hmm. No. The unhoused population is always a tough one to study. So the meta-analysis that we relied on to do this specific research was a cohort studies from around the world, and offhand I don't know if any of them included unhoused people, I would doubt it, just if I had to guess. But yeah, a challenging population but important population to study.
Another question is sort of, there was a question about sort of one of the slides, one of the images, let me find that. So this person asked about the demarcation line to the west of Denver on the satellite map.
Uh-huh.
Do you know what I'm talking about? Where the land turns green is where they wanted to know what that demarcation was.
Maybe that one? No.
Oh, sorry. I think it's a little farther earlier. I think I know what you mean. Yeah, this one. Yeah, I think it's like Mount Morrison, maybe. Or, yeah.
Oh, okay.
Yeah, because that's like Red Rocks is kind of over there. Yeah.
Yeah.
So that would be just when the mountains go up.
Yeah.
Yeah.
How are we doing on time?
Well, we got a few minutes. It's only been 35 minutes since the talk started. It made up for all the rest of us.
Oh, Michael, you're so good. So this person actually asks about, and this is something I'm actually curious about too, because just speaking, of course, anecdotally and just personally, the more that I'm around different kinds of plants and different kinds of animals, that heterogeneity, that, it makes me feel good. I can't say that means anything to anyone else, but that interaction with different kinds of species, that kind of looking at biodiversity and just sort of maybe that's a mental health thing or a social interest or engagement thing. But this person asks, have you thought about studying the impact of raising honeybees on health? And I think kind of aligned to that, like gardening or being involved in stewardship or being involved in community science, we're actually looking like into the eyes of a bumblebee. How might that impact human health in a way that maybe just living near a green space or maybe even just walking through a green space? Do you have any sense from the literature about what that impact would be?
Yeah, I don't know the literature offhand, but I do think that'd be a really nice way to study, because much of this research just looks at proximity to green space and doesn't actually follow people who are kind of have it as a central part of their daily activities or their hobbies to raise honeybees. At least, there may be studies out there, but I think that would be a really nice way to kind of add a different perspective to this literature, which is just not based on like, okay, do you live close to a park, but are you kind of engaged in a perhaps more, more, I don't know if meaningful is the term, but in a more like kind of hands-on way of engaging with pollinators and native plants. So yeah, future study.
A lot of future studies.
Yeah.
And we also have a question about sort of your definition of native plants versus maybe vegetation that is just unmanaged or not cultivated.
Yeah. So I asked our colleagues about this, and if I don't want to speak for them, but I think there was a little bit of reticence of just focusing on native plants per se, and also because I think it was maybe Michael Garber's research found that lots of pollinating honeybees didn't necessarily prefer native over just other adaptive, highly diverse landscapes. And so we chose native, I guess, just to kind of give it some sort of a restriction and have a definition. But yeah, we struggled a little bit with how to differentiate the plants that we really wanted to study compared with, I guess, maybe the prototypical like turf grass. But yeah, I think we tried to settle on like native or highly diverse or adapted, which is not a great definition because it includes a lot.
Well, and like the highest NDVI was like golf courses.
Yeah,
and it's like,
exactly.
oh boy.
Right.
Oh boy.
No, exactly. Which is why, like, yeah, I think the literature just focusing on NDVI is like, well, you can just build golf courses and would everyone be healthier? Probably not. So.
Yeah, absolutely. All right. So thank you, Michael.
Yeah, thanks, Amy.
And
Thanks,
yeah,
everyone.
another round of applause.